before that, I just wanted to say, life is all about decisions. Life is all about choices, isn't it? We all have choices that we can make. But what do we choose? Sometimes we find it difficult to choose something over the other. And all our life, we don't choose the right thing only because of some fear, or sometimes it is because of lack of information. We may not know the right things. There is nobody to tell what is right, what is wrong. And if that is the case, we spend all our life in agony without knowing what are the options. Now, being a patient, going through that suffering without knowing the options, or if there is some kind of a fear, or if there is no courage to opt the right treatment, I know it is very miserable. But here, I have really strong set of people, and I'm so proud of everyone over here who's there to share their opinion and what they felt about the fibroid embolization. Fibroid embolization, this name sounds, very complicated. Fibroid, and those of you who want me to talk in Tamil, I'm mixing Tamil and English is also okay. So, fibroid embolization அப்படின்றது என்னன்னு பார்த்தீங்கன்னா கர்ப்பப்பையில கட்டி. So, கர்ப்பப்பையில வந்து கட்டின்றது நிறைய பேருக்கு இருக்கும். But there are few people who can be symptomatic. Symptoms எல்லாருக்குமே இருக்காது. There are few people who are symptomatic and they don't go and see a doctor. ஏன் அப்படின்னு பார்த்தீங்கன்னா ஒரு பயம். போனா இந்த சர்ஜரி பண்ணி பார்ப்போம், என்ன பண்ண போறாங்க அப்படின்ற ஒரு பயம். அதனால we don't go to a doctor at all. Yeah. So like this, we have so many people, amidst us. Without wasting a lot of time, I'm diving straight into the topic. Adukku munnadi, I would like to introduce my team at Rela Hospital. Okay, my lovely team, and without the teamwork, nothing is possible. Okay, so before I dive into this, let me introduce Sankesh, who is my fellow. So Sankesh, you want to come forward? Yeah. So this is my fellow at Rela Hospital, Interventional Radiology. அப்படின்னா என்ன நீங்க எல்லாரும் இந்த செஷனுக்கு அப்புறமா எல்லாருமே புரியும் what is interventional radiology. We are minimally invasive surgeries. What do? We don't do surgery, but then we treat the tumors, we treat varicose veins. There are a lot of things that we treat in the entire body. So we are interventional radiologists and we are doctors. நிறைய பேர் வந்து interventional radiologist அப்படின்னா MBBS டாக்டர் அப்படின்னு கேட்பாங்க. ஓகே, டாக்டர் நீங்க MBBS பண்ணிருக்கீங்களா? இது வந்து ஏதோ ஒரு டெக்னிக்கல் ஜாபா, நீங்க டெக்னீஷியனா அப்படின்னு கேட்பாங்க. So I'm not saying technician is a low-end job or anything like that. Not like that. What I want to say is we are also doctors. ஒரு 10 வருஷம் படிச்சதுக்கு அப்புறமா தான் வந்து interventional radiologist ஆக முடியும். So there is unfortunately the awareness is lacking in India, but we are interventional radiologists and that is Sankesh at Rela Hospital. How are you finding?
I'm finding this a new journey, a journey where I'm able to explore the depths of advancements in technology and learn so much more under a man which I had never anticipated before. This is completely a new ocean for me and it's so lovely to be here. I've been here only for the past 8 months, but it feels like I belong here.
Yeah.
Thank you.
Thank you so much, Sankesh. Obviously, he has to talk good things about this because Nella Vishwam basically has no other choice. So that's Sankesh, and we have Balaji. Do you want to come over? So Balaji is, he is the go-to person here at Rela Hospital. யாருக்கு எந்த பிரச்சனை இருந்தாலும் just take your phone numbers and please note this number right now, 044-6666-7725. Please make a note of this number if you want to reach out to Balaji, the man at Rela Hospital. Already he's got some hundreds of phone calls every day. I'm so sorry to put this as a burden. So do you want to take your mask off and show your beautiful face? Yeah, so that is Balaji. So you got a number again, I tell you once again, 044-6666-7725 is the number if you want to reach out to us at Rela Hospital, Chennai, which is in Krompe. So Balaji, so how are you finding the journey so far? I know it can be stressful, but are you enjoying helping so many people?
Yeah.
Life is stressful a bit more, but
I enjoy the work which I do.
Yeah.
And it's like a bit stressful, but it's okay, but we're helping the patients out.
Yeah, and the stress is not going to go. See, sometimes we do a lot of things, but when you understand that இத்தனை பேருக்கு வந்து நம்ம ஹெல்ப் பண்றோம் அப்படின்ற ஒரு கான்ஷியன்ஸ் நமக்கு வரும்போது வந்து the stress immediately dissolves and we don't feel stressed because we are helping more people. Stress for no reason is a bad stress, but stress with a reason is always a good stress. So what he implies is a use stress, not a distress. So which is really a good thing. Thank you so much. And Moses, please come. So those of you who've been following me on the Facebook, you have seen Moses along with me. So this is a guy who's been with me in this journey for the last 10 years. Extremely exceptional nurse. So without this team, உங்க எல்லாருக்கும் அந்த treatment நடந்திருக்காது. So you just need to give a big round of applause. And the man who's taking the video. You want to show Jitu, who is going to come and stand next to me, and he is my fellow. This is the person who's been, he's my senior fellow at Reda Hospital, and I'm 100% sure you're enjoying your fellowship. Yeah, so
Absolutely.
yeah, very good.
Learning a lot. I'm getting a lot of patience. அதோட மேம் சொல்லி கொடுங்க எப்படி எப்படி பேசணும் எல்லாமே சொல்லி கொடுத்துட்டு learning a lot of things. Very good experience, sir. Thank you so much.
Thank you. So he's a sweetheart in the department, and he strikes a very good rapport with all the patients. The most important thing is the connectivity with everybody. உங்க எல்லாரும் வந்து ரீச் ஆகணும், உங்க எல்லாரோட ஒரு கனெக்ஷன் அந்த இருக்கணும் அப்படின்னா it is impossible if you don't have good people skills. And I think Jitu is one person who's got exceptional people skills, and that is something that I learn from you every day. How to be with people and how to talk to people. இது எல்லாமே வந்து he knows, and எல்லாருக்கும் சமைச்சு கொண்டு வர ஒரே ஒரு person. Jitu, so we all love you. So the way to not just a man's heart, even to women's heart, is through the stomach, and that is possible. So thank you so much. So you can get back to your job of. So that is. Naveen. Okay, please come. So எல்லாரையும் introduce பண்ணிட்டேன். If I don't introduce them, I think this will be a grave mistake. CT and MRI technician. So எல்லாருக்கும் வந்து கர்ப்பப்பையில கட்டி இருக்கா இல்லையா அப்படின்ற ஒரு விஷயம் first கண்டுபிடிக்கிறது through Naveen. If he is not there, we would be able to. Sometimes patients come and see me, late evening வந்து பார்ப்பாங்க. அந்த மாதிரி டைம்ல வந்து any time I call him and I just tell him, Naveen, இந்த patient ஒரு MRI scan சீக்கிரமா கொஞ்சம் பண்ண முடியுமா? நான் நிறைய பேர் வந்து இல்ல முடியாது, லிஸ்ட் ஃபுல்லா இருக்கு, I cannot do this right now. You will get those kind of reply from few people, but there are very few people who will say yes every time you say there is a scan which needs to be performed on so and so patient. He's the only person. Middle of the night at 2 a.m. if I call him, he will say yes madam, பண்ணிடலாம். Okay, அந்த மாதிரி ஒரு டீம்ல வந்து ஒரு ஆள் இருக்கிறது நான் ரொம்ப கொடுத்து வச்சிருக்கணும். And again, Naveen, I'm so proud and so glad, so blessed to have you in my life. Not just a friend, he's more than he's like a friend to me. So thank you so much. Thank you. Okay, so right now, so we'll just go and I'll just introduce everybody, and then I'll probably go one by one and tell you there. I just want to know their experience. So first of all, fibroid embolization. Already I have told you all. Fibroid embolization is nothing but treating fibroids. Fibroids are benign tumors. Benign tumors are these are not cancerous. Those of you who are watching here, I just want you to understand, please don't get scared by the word fibroid. Okay? This is not some kind of a malignant cancer. Malignant cancer, there is a difference between cancer. Okay? There are types of cancers which spreads in the entire body. Number 3, it can spread. Fibroid is not something which spreads and which causes some kind of other cancers. Okay? So this is not a dangerous tumor. But yes, all of you should get embolization or should get surgery or whatever is offered to you, because it gives a lot of symptoms. So there are a lot of symptoms that fibroids can cause. And symptoms are there over a patient. First, this is a person who was actually she's a mother of one of my patients, Kavita. So இவங்க வந்து பாத்தீங்கன்னா எல்லாரும் மாதிரிதான் வந்து fibroid இருந்தா ஒரு புது ப்ரொசீஜர் எல்லாம் எம்பலைசேஷன் அந்த மாதிரி எல்லாம் ஒன்றும் வேண்டாம், நீ வந்து யூட்ரஸ் எடுத்துட வேண்டியதுதான், எதுக்கு உனக்கு யூட்ரஸ் 42 வயசு ஆகுது, உனக்கு யூட்ரஸ் எதுக்கு அப்படின்னு சொல்லியிருக்காங்க சொல்லி கவிதா என்கிட்ட சொன்னாங்க. ஸோ அம்மா கிட்ட வந்து ஃபர்ஸ்ட் going to find out from her எப்படி அவங்க மனசை மாத்திக்கிட்டாங்க, எப்படி வந்து ஒரு யூட்ரஸ் எடுத்துட்டு அப்படின்னு சொல்றவங்க வந்து இல்ல வேண்டாம் நீ போ அப்படின்னு சொல்றாங்க அப்படின்றது. We are just going to find out from her how she changed her mind and encouraged her daughter to go for embolization rather than hysterectomy. Okay, and before that I just want to say, I'm not here to say people should not have hysterectomy or myectomy. These are all the options. Okay, the option is, the choice is yours. I'm giving you the choice. If you want, you can have the embolization. If you want, you can
sitting with you.
Thank you so much. Thank you, Kavita, for sharing that. So last Monday she had the procedure done, and you can just see she is the youngest patient. in the patients on the seniority, on the senior most on the So there are people who had in fact just 3 days முன்னாடி பண்ண ஒரு patient கூட she was willing to come but she couldn't come, but otherwise she was also willing to come. So what I mean to say is you can be active immediately. So there is no bed rest that we recommend. It's all, everybody's body is different. Yeah. Some people recover in 2 days time, some people recover in 3 days, but some people recover. You recover. I'll come back to that. So the recovery time of the embolization or the recovery time after the fibroid embolization, it's variable. So if you have a viral infection, this is what I tell everybody. So if you have a viral infection, some people recover in 2 days time, some people take 3 days, some people take 1 week, some people take a month. So it's highly variable. So that is what I want to share. And now next moving on to Elizabeth and Merlin. Merlin is a patient, she came in herself, and I just want to ask Merlin, how long have you been suffering from fibroids?
Since my son's birth, it's 13 years since I've been having fibroids, but I've never given it a heed at all. Like, sure. So basically, no, never given a heed, even if it is there, right? I've never given a heed. I'm a very, very kind of, my day is very eventful, right? I'm a HR financial organization, and very busy day I have. So I've never thought about treating it until and unless I had pain and I had to fall on bed, right? That's when actually my people around me actually saw me on bed and they immediately had to take action. Like my friend couldn't see me at all. I was in my in-laws house. She just pushed me out of the house and brought me to my mom's house. And almost the next 2 days I was here, right? I had a cousin who had recommended you, and he said that I shouldn't go for a hysterectomy when this option is there, right? And I was totally told that I can recover in 1 or 2 days time, and that's what I was looking at. I didn't have time to relax at all, right? And this is one of the best options I can suggest every person, right? There are people who are very busy today. They don't have time to take a relaxing period for 2 months after hysterectomy or so on. This is a very easy procedure, I would say, right? There's no risk involved here. People may think, right, the words are very difficult to hear, right? Interventional radiology. First time I like, what is that?
Yeah.
But actually, when you get into it, right, when I tell people now, I take a few minutes to explain what it is, right? At least already 4 people have shown interest to do this. There's so many women out there who don't know, the awareness is not there today, right? They need to be informed that this is there. That's why I thought, like, whoever I meet at least, right, they haven't seen me pause for a period. I've paused for the last 2 months and I'm back better and stronger, right? That's what I wanted. That's what I wanted to get back to. I never wanted to, go slow. So the pace has actually pushed me forward faster now. So I should thank you really and your team, right, to get me moving so quickly, right? Recover. And I don't have that thought at all, right? That pain which came to me is never there again. That's what I would recommend all people. Please tell your folks also, create awareness on this, and I really hope that people don't move to that hysterectomy where there's a lot of procedures. And I think about it, right? That there's one organ which is not in my body anymore.
Yeah.
It really scares me. So this is a very easy procedure, and when you were doing the procedure, right? I know your team was there, and you were very, 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 passionately doing it, and no fear or no anxiousness or no tension on the table, right? Very calm and cool and composed team which was working on. And we're just done. It's over. And I had so many fibroids. It's just I'm not sure how many of them are having so many fibroids. I had 5 large fibroids and multiple small ones, right?
Yeah.
We're like, in 45 minutes we're done with the whole procedure actually. I was so impressed with the team. And I was so happy, right, While I did have pain after the procedure, but it really, now I really don't have that in mind that there was something in my uterus at all. It's just all over and done. So I keep moving forward. That's
Lovely.
Yeah, I want to add a point here. Actually, like this, I could say it's good news for us. Actually, when she fallen sick and when I
sharing that. See, one thing that I really want to say is positivity is very, very important. Like for any patient for that matter, when they're going for any treatment, you need to be positive. You need to not just have confidence and trust on the doctor, but you need to feel positive yourself. And this is what I tell every single patient. It's 50% is with you, 50% is with me. And that 50% of my job, I do it 100%. Yeah. So, if your fibroids haven't regressed, I'm sorry, it's you. Okay. So, I'm very sorry to say this, but then I just believe a lot in positivity and wherein your thoughts kind of they help in fibroid regression as well. And people out there can criticize, they can say, what is she talking about? This is not true, etc., etc. But I'm just going to prove it to the rest of the world that your thoughts, they do matter. And so all of you here, you're all super positive people. Otherwise, you wouldn't have the response. Okay? So the way you were speaking, the way you were talking, it just shows you already made up your mind, right? And get on the faces like, it's just a little the reassurance on the thing. But you all would have made up your mind, yes, I need to, go for this. It's not like you come to the hospital without knowing what embolization is. You all have made up your mind, you all are strong enough to make a decision, and that is what brought you all here. And thank you so much. And as she said, it really feels good when she said that, we were all cool when we were doing this. So one important point I want to say is, nobody is given general anesthesia when we do this procedure. So this procedure is done under local anesthesia and epidural as well. So people are awake, patients are awake. You get to understand and you get to know what is happening with your body right there. So that is the beauty of this procedure. We don't even knock you off completely. And thank you so much for sharing this opinion about the embolization so beautifully. Thank you so much. Thank you. Now moving on, we have Manju. Okay, she's one of these cutest patients I have. She's like, she's like I would think you're my hardcore fan. Okay. So Manju had, she's wanting to have kids. See, what I want to say is there are a lot of people out there for whom hysterectomy is not an option. What if you have fibroids and you want to preserve your uterus because you want to have kids later on? Yeah. So you can't throw the uterus in the bin if you want to have. You need the uterus to have a baby. And this is Manju is one such patient who came to me and who said, "Ma'am, I'm planning to get pregnant, and I just need." She had. Can I share? Yeah. She's one patient who said, she also had. She was finding it difficult to conceive, and that is the reason why she came to us. And so she went ahead with the embolization. I just want to understand from Manju, her experience, what made her come to us.
I'll take longer time to say.
Yeah, please take your time.
So from starting, I want to say I've done 3 myectomies first of all. From the age of 25, I've been suffering. It's been 13 years with the fibroids I'm suffering. It's full of multiple fibroids. So if you see my stomach, it will be like only stitch marks will be there on my stomach from left, right, this, that, and all. And the 3rd surgery was a wrong surgery where I went, and that's the moment I thought like my life is gone. That's all. I was like in bed, only in the bed and restroom. That was my stage. And actually, Man's Global Hospital, I believe, like a person who was working under you, Joseph, he referred ma'am and he got an appointment with her. That was the time I was coming and meeting ma'am. So I thought like it will not happen. This is the last step I'm going to give, or otherwise that's it. That was my stage. And when I came here, like full of hope I came here. But while stepping out from man's cabin, like I thought like I'm going to be back. This Women's Day, like I'm like a proud woman who's sitting here. But next Women's Day, definitely with the kid I'll be here. So lots of pain, like very emotional. My whole family said like we want to remove the uterus, there is not required, we can adopt, we can do this, we can do that. Everyone has their own thing, but I personally I want to have my kid. So I thought like I can't able to have, after coming to Dr. Deepa, like she's like my sister, she given me so positively like Still now, like I don't have second thought at all. Still, the pain was heavy when I come to her. It was multiple. Before a surgery date also, I'm not sure that they will be doing the surgery or not because it is like multiple. The total, everyone say like it is all into your other parts. So it is very risky and other thing. But she gave me lots and lots of hope. And today what I am is only because of her. I'm sitting here very, very, very happily. I can say that. Thank you so much.
Only one thing, she's sitting here because of her, not because of me. I haven't done anything over here. So it is again, it is a positivity. It is your strength. It is your courage which drives you to lead a life. And the fact that you challenged us today, next year, this time, same time, March 8th, you're just going to breathe the baby. That is your strength and courage. Okay, so just be proud, and that is you. Okay, so thank you. And now we move on to my senior most patient. Okay, so we have, it's all okay, guys? Anything, technically any problems, nothing, right? It's all fine? We have to be louder? Okay. I'm actually shouting on the top of my voice, so. Okay, alright. So now we have Maheshwari. So the sweetest thing about Maheshwari is, there are a lot of people, I'm so glad that you all came forward to kind of get exposed to people and say, look, I got this done. There are a lot of people, who have the treatment and they don't have the courage to come forward and say, yeah, I had this. People say, nobody should know that I had this. No, it's not that. We all have a mission in the world that is to help someone else. Yeah. And the fact that you all have come here, you are helping that one person who might be sitting there and watching and thinking, oh yeah, I don't have that. Okay, so you are helping that particular person. So I'm so proud of you, and I'm very proud of Maheshwari because she is the person who first came to me and then she said, Madam, any time you call me or any patient who wants to talk to me, I'm there to share my opinion and I will give my honest opinion. And there is no bias here. I just want people to share the honest opinion. And anyway, all the guys sitting here, I never got a chance to introduce you guys. So again, we have, Jagan. Yeah. So Jagan is Maheshwari's husband, and again, we need to have people who just give that support and who just encourage people to go for certain things. And there are not a lot of people who say, okay, fine, why do you want to go through all this hassle? So you need that support from your partner. And again, I'm so glad that you have supported her through this, and then you brought her over here, and I'm sure you have done a lot of googling or whatever. But then, thank you so much for being the support, sir. And Maheshwari, just share your experience about this whole thing.
Yeah, really, I'm very glad to be here. Especially Deepa ma'am. I would say thanks, lots of thanks. A simple thanks won't make it up because that much of pain I undergone before. And after this embolization, the life has completely changed. And I don't know how happy I am. If I speak much more, I'll be emotional, I'll get tears will come to my eyes. That will be like. And once I realized that I was out of this, that my life is completely changed. I want this has to be happen to every woman who was suffering like me. So I came to Deepa ma'am and told, ma'am, why is this not why is not being aware of this among this woman? Why is happening like this? But whenever we go to the gynecologist, the first he will say, please remove the uterus. Once we get fibroid, remove the uterus. That's all. There's no second opinion at all. And mine really, I have to thank you Corona for that time. Means I mean, teaching me like anything. But the thing is, all the operation theatre was closed for me because of Corona. Otherwise, by this time I would have removed my uterus. I would have been, I don't know what would have happened to me. Yeah. And so this is the situation. So what I can do, where I can go. No idea. My husband chose a family friend who came to my husband. His name is Johnson.
Yes.
Your friend too. Yeah, your friend too. So he came and he spoke to my husband. My husband came and told me, this is a way out. Okay, come, we'll go. Because all the doors are closed for me, so there's no other door. There's one more door is open, so every time we go and enter and see what is inside. So I went and met ma'am, full of positive. I did even, first time I'm hearing the immunization, the word. And radio, I don't know anything about that. See, with honesty I'm speaking, ma'am, nothing, I don't know anything about that. So, what I can do for my purpose, to survive at least I can see. because my position was that bad. So when you say, when you gave me the courage, when you gave me the positive thought, there's going to be one thing I was really happy about that is no switches. The very next day you can go home and you can be a normal person.
Yes.
The 3 points impressed me a lot. As she said, what she said is 100% true. We don't have time to take our own time for the rest.
Correct. Correct.
Okay, yes. Anything the time is ready, but for taking rest for a personal thing, no. No.
So true. So
Yeah.
true.
So we have to think about that. Though it is a corona and a teacher, because I have to go for online, many things are there.
Yeah.
So I thought, okay, we'll go ahead. Whatever, if many people tell me, no, this side effects are there, this side effects are there, this there, that there. I said, side effects are everywhere.
Yes.
So we'll go and see what side effects is really giving me. So
Exactly.
I went to the clinical G. I don't know, these people say they have undergone the pain and all. And honestly, I'm saying I didn't undergo any pain.
Yeah.
I was being, what was the very next day, I was a very normal person. I will be searching where I was a stitching pain and where they used to poke me somewhere or here or there, but I didn't see any mark on my stomach, but I'm over it.
Thank you.
The past 2 years I'm here, the 2 years was going on very normal. I'm leading a very normal life as I said before,
Yes.
and I feel very entertaining.
And you look younger. It's not just skinny, you look younger too.
I'm 46 actually, but my son is 25 years old.
Wow.
Yeah. And I'm the happiest mother and I think good wife.
You're a complete woman.
So I'm really happy, man. Then also I tell you, wherever you call me, I will be there.
Thank you so much. Thank you. That's the best gift, guys. I mean, actually, it's quite emotional as well when you think that, you could make a difference to so many people's lives. And I don't know, I'm just doing this every life because I just felt like doing it, but I really don't know. But I wouldn't mind catching up for a party with you guys. It is such a lovely thing to have you all over here. So for those of you who are listening, for those of you if you're wondering what embolization is all about, it's just similar to an angiogram. It is similar to a coronary angiogram. All that we do is we just get into the uterus using a small tube. It's a pinhole surgery. It is not something wherein you use knives to cut open. It is not something wherein you have the sutures or scar. Cosmetically very, very appealing, like Maheshwari said. And so we just get into the uterus, and wherever there is a fibroid, we block the blood supply to the fibroid using some particles. Okay, we have certain medicine which kind of blocks off the blood supply to the fibroid. So what's happening? Your uterus is absolutely safe inside, and that is what is embolization all about. And you can get back to work the next day. So for people who are leading a fast-paced life nowadays, we don't have time to take care of ourselves, right? So although we should take care of ourselves, we don't have time to take care of ourselves. And so sometimes you just want to get over and then crack on with your work from next day or within 2 days ASAP. That's what you all want to do. For that, this is probably one of the options that you can think of. Having said that, I don't want to undermine surgery or myomectomy. See, nowadays we have myomectomy also. Myomectomy is like scooping out the fibroid, taking out the fibroid, and again, people can go home probably the same day, but that works only for certain category of patients. If you have multiple fibroids like you had, myomectomy is probably going to be challenging for people to kind of scoop out multiple different size fibroids everywhere. But sometimes, if I feel that a patient is suitable for myomectomy, I do tell the patients you should go for myomectomy. Yeah, so I don't want to undermine some other procedure and say this is the best and we offer the best. All that I want to say here is you have this option, so think about it. Think about paneer, not just sambar. So is what I'm trying to say. So it is your choice. Whether you want to eat sambar or have paneer, it is your choice. I'm not here to impose on you, but you need to know your options is what I'm trying to say again and again. So now we have our most vibrant, youngest patient. She's a yoga instructor, and Maheshwari's husband is also a yoga instructor. So when they came and saw me, they were very, very clear. She said, "Man, I'm not worried about pain. I had normal delivery." You are the one who said that, right? She said, "I have 2 kids. I had normal delivery, so I can tolerate pain. Absolutely no problems with that, and I'm ready to go for it." So she was one of these super positive patients. patients, and then I could see the positivity in her, I could see the positivity in her husband, and I was pretty confident that, you know, when I see that positivity go on, I don't know about me, I just say, you will be fine. Okay, the procedure is going to give you very good results, because that is what I look into. Like how you look in a doctor, we also look for certain things in patients. Yeah. So not every patient is the same. So for everybody out there, be positive and believe in yourself that this is going to be okay, and you will be okay. Like all these people are over here. So Maheshwari, so I just wanted to share your genuine experience. I know you had some pain, although you were ready to handle the pain. You did go through some pain. So how did you come out of it, and what did you feel to share your experience? Oops, sorry.
Thank you so much, mostly about you. I'm proud about you. So, எனக்கு ரொம்ப சந்தோஷம். So, past ஒரு 6 years, I felt very uncomfortable. Uncomfortable ஒரு 20 days and periods போகும், 5 days stop ஆகும், again இருக்கும். So, நிறைய doctors, I saw many doctors. ஒரு doctor, all our students also. So, we met them. அப்புறம் அவங்க என்ன சொன்னாங்கன்னா, இல்ல uterus immediately you have to remove the uterus. Then I very I'm not interested to go to the doctor. Mostly I don't like doctor. So, but I never been the doctor. Hospital எதுக்குமே நான் போனது கிடையாது. Only டெலிவரிக்கு மட்டும் தான் போயிருக்கேன். I'm also 46. Mostly I'm grandma. எங்க பொண்ணு கல்யாணம் ஆயிடுச்சு. So we are all like feeling like எனக்கு கொஞ்சம் ஆயுர்வேதிக் மெடிசன் நார்மலா என்னெல்லாம் பண்ணலாம்னு we have to do it for that. அதுதான் நான் எல்லாருக்குமே சொல்றேன் அந்த மாதிரி. So mostly one more support I brought about my husband, because he is positive and சொல்லி பண்ணுவார். அவர் தான் சொல்றார், we can do it, no problem அப்படியே தான் சொல்றார். But we went to many doctors, எனக்கு சர்ஜரி இஷ்டம் இல்லை. I took a lot of ayurvedic medicine, yoga practice எல்லாம் பண்ணேன். But I'm not happy, because my mind was நல்ல பலூன் மாதிரி இருக்கு. So I get very big fibroid. I don't know how much things are going to tell you. So like that much big fibroid, I can't lie down on the bed. அந்த குப்புற படுக்க முடியாது. So கட்டி வந்து அழுந்தோம். அந்த அளவுக்கு. Even though I'm thinking, okay, we do what happened like that. Only one doctor is making me afraid. I'm very strong woman. Even though she's making me afraid for immediately admit in the hospital for the November 24th, 27th, we had surgery, open the everything's gone, finished. Why you need for the uterus? You want to remove the uterus, one or bad, like you know, like that. Then after I thought, எனக்கு ஒரு பேக் அது, எனக்கு ஒன்னோட பாட். This is my pot, not for your pot, no. So first time in our life, I think about myself. I cried to my husband. இப்படி சொல்லிட்டாங்க, எனக்கு பயமா இருக்கு. My husband said, no, அவங்க doctors like the doctor, so don't worry about that. So one of our students, we called them because 24 days அப்படி periods போயிட்டே இருக்கும்போது he called to one of our students. He's a doctor. Then he's giving some operation பண்ணாமே we can do it, something there. But first we have to stop the periods. அப்புறம் தான் we have to go to the other section. So we go to check up one more doctor. We went there. They are also saying first we give the medicine, everything, we stop. Then we think about that other options pain அப்படின்னு தான் சொன்னாங்க. Even though I have a doubt, then I called to one of the டாக்டர் என்ன சொன்னாங்க, தீபஸ்ரீ மேம் அவங்க வந்து நீங்க யாராவது உங்களுக்கு லண்டன்ல இருந்தாங்கன்னா அவங்க ஸ்டூடெண்ட்ஸ் யாராவது இருந்தா நீங்க வந்து என்கொயரி பண்ணிக்கங்க, யூ ஃப்ரீயா அவங்க மைண்ட வச்சுட்டு நீங்க எதுவும் டவுட்ல வராங்க, எனி டவுட் யூ கால் மீ எனி டைம் அப்படின்னு தான் சொன்னாங்க. தென் ஐ கால் டு லண்டன். ஸோ அந்த இந்த மாதிரி ஒரு டாக்டர் சொன்னாங்க. ஸோ தட் இஸ் ரியலி தட் இஸ் ஹேப்பன், தட் இஸ் ரியல் திங்ஸ் இன் லண்டன். ப்ளீஸ் யூ டெல் மீ and I'm going to ready to surgery அப்படின்னு. அவங்க சொன்னாங்க இட்ஸ் a common for here everybody. There's a doctor சொன்னது உண்மைதான், you have to do it like that. So immediately my husband also said, don't worry, first thing we go do that. If you cannot work, you can open the surgery. So open surgery பண்ணிட்டு you cannot go other things, you know. So two choices இருக்கு நமக்கு. So first thing the choice பண்ணுவோம். So after you know same இருந்ததுன்னா then we go other things, you know. First we go. So I want to say to my husband, so he support me. அவங்க சப்போர்ட் பண்ணனால தான் I came to mostly. I'm also strong even though my feeling I am not here. So I came and thank you so much. இப்போ ரொம்ப நல்லா இருக்கு. So I'm every 15 years 20 years இருந்த மாதிரி அந்த body, so everything is very normal, we are doing everything. So now I'm doing asanas almost fast for we didn't do it for us. Pain தான் எனக்கு இருந்தது. I get pain but it depends on the bodies, you know. Over personோட body different தான் pain. But ma'am I called ma'am, still pain I have 20 days. What you do? So Maheshi, don't worry, send me your pictures. I'm healing for you. See, every day she's healing to me. So I'm getting very better. Thank you so much, ma'am.
Thank you so much, Maheshwari. So Maheshwari, so the Madri, see, all of us, we have something called as a herd mentality. Herd mentality, அப்படின்னா என்னன்னு பாத்தீங்கன்னா, you know, like whatever is a popular thing, we think that is the right thing. Yeah. So what is a popular thing? Popular thing is okay. Everybody kattiya two pieces. Okay. So so popular things are not always right, and right things may not always be popular. Okay. So this is something that I really very strongly believe in. If somebody is wearing torn jeans, does that mean everybody should wear torn jeans? Yeah. So எது நல்லது எது நல்லதில்லை, எது பண்ணணும் எது பண்ணக்கூடாது, whatever, you know, that choice we need to decide for ourselves. Okay, just because something is popular, நம்ம எல்லாரும் அந்த பக்கமே வந்து okay அதுதான் கரெக்டான ட்ரீட்மெண்ட், this is what everybody thinks. It's not about that. So we just need to understand. I think that intelligence you had to discriminate, and yes, as she said, everybody will have lot of doubts. What is she trying to do? What is she going to do? So உங்களுக்கு அந்த மாதிரி doubts இருந்துச்சு. And one important thing I want to say is, you know, regarding the healing as well. So healing is something that not everybody is aware of. And if I say that I can take away the pain, I can heal your pain, I don't want to kind of, you know, blow my trumpet saying that, but please, the power is within you. The power is within you. Okay, you can heal yourself. I said I'm just doing a distant healing on a picture which I'm heal padran. I did something. We can send out the energy. If all of you believe in God, how is God healing you? Okay, all of you, those of you who believe in God, it's a distant healing, right? So you all believe that He's going to heal you, and then it heals. Okay, and if you're believing in that, that energy is very much true. So that is there. I think you heal yourself. Okay, I didn't do much. So that is what it is. And thank you. And on the Neelangare, right, in the yoga center. So she Moksha Yoga. Okay, so those of you who want to learn yoga, somebody here watching somewhere near Neelangare, udane poi parishnika paavanga. Okay, even I am planning to go and take some sessions from Maheshwari. After a long time, I had this. I still have got this thing about putting my head down and you know, feet up and do this. And what is it called? Sirisasana. Adu pannanom enakku romba aasa. So I hope she teaches me one day, and I want to do that. So that is our you know, group of fascinating, positive people, you know, who had this treatment and who shared their experience. So I really can't thank enough for being here with me, for sharing your experience, and for all the lovely stories, and for enlightening people, for the awareness that you brought about, which is impossible otherwise. Okay, so what we need to do is reach out to people and bring about the awareness. So on the occasion of Women's Day, I just want to kind of end this with just one tip which I follow. People ask me sometimes, you know, I'm jolly, I think about the dance happy, yeah. So I just want to tell only one thing. For those of you who think, okay, you know, you're very happy, you know, I'm not happy in my life. You know, why are you so happy? You know, is everything happening okay in your life? So for those of you who think, I just want to say one thing. I do something called as an ecology check when I wake up in the morning. Yeah. So what is ecology check or a quality check? Okay. So உங்க வீட்ல வந்து ஏதாவது ஒரு மெஷின் இருக்கு அப்படின்னா sometimes even in the hospital time to time machine சரியா வேலை செய்யுதா இல்லையா, you keep checking it, right? You do something called as a quality check. So every morning when I wake up, I just think to myself, make my day. Okay. When you wake up, the thoughts that we have is, I have to get up, I have to take care of my husband, and go to school or whatever. Now she has to teach yoga. First thing which comes up is on the day or a full schedule or you have a mental movie of the entire day. And especially when you have a stressful day, in the sense that when there are a lot of things that you have to do, it runs like a movie as soon as you wake up in the morning. Yeah, this is what happens. Now this is called as an ecology check. So when that runs as a movie, we don't even think what is running. Immediately we get stressed. There will be like a hormonal surge, you get stressed, that kind of a feeling. So when you have that, you need to understand, you need to think about your thoughts. When I have those thoughts, you just need to put a break to those thoughts. Rather than thinking how my day is going to be, you have to understand, what if I do something which can cheer me up and also cheer others up? Okay, there are a lot of things in our life wherein you can you go back to your childhood. When you go back to your childhood, nobody tells you what to do. How is a child? Child is very, very happy. You may say, oh, child doesn't have any responsibility, that's why they're very happy. Not really. Okay, if it's all the conditioning. We have conditioned our mind in such a way that responsibility I cannot be happy. I'm very stressed. Not really. Everybody, all these things will be there. Okay, if you think the day I buy a car, the day I get a big house, the day I find a new job, I will be happy. Those things are not under our control. What is under your control? Your control is you. How you can change your thoughts is very much under your control. So you can change your thoughts by doing something that you like. So I wake up and then I spend my day, or rather I start my day with a dance because it is something that I love. Okay. So, and all of you, if you have some passion, do something which gives you a smile on your face. Okay, just like half an hour. So when you start your day with something that you love, your day is going to be great. And that's all it is. That doesn't mean you don't have to look for people to make you happy. When you start chasing and when you start looking for your husband to make you happy, or for your mother-in-law to make you happy, or your kids to listen to you, these are all things which are not under our control. If things are not under our control, you will be depressed and you will be stressed for the rest of your life. So do things which are under our control, and the choice is yours. Yeah, so the choice is very much within you. Whether you want to choose this, whether you want to wear yellow color or orange color or pink color, it is there very much within you. Yeah, so you're not going to ask somebody to choose that for you. So you can choose what you want. Consciously being mindful of your thoughts every single morning helps you a long, long way going forward. And if you can't make yourself happy, if you feel, oh, I don't have time to dance, I don't have time to do all that, okay, I don't have time. So how can I be happy? Go back to your childhood. Okay, go back to the days when you had really happy moments. I'm sure all of us had happy. What I want you to do is think of 3 happy moments from your childhood, from your teenage years, during your childhood, whatever. Just think of those happy moments just before you fall asleep. Just before you fall asleep, and wake up thinking about 3 positive moments, 3 happy moments, 3 confident moments. The day you felt super confident, the day you felt super positive. I just want you to start your day with those thoughts, and when you think of those happy moments, the positivity, the confidence, the happiness, it just goes like a shower from the top of your head all the way down to your feet. Okay? So you feel so happy, so powerful, so confident, if you just think, that's it, you'll just go somewhere else. And when that happens, you start attracting more of happiness, more of power, more of positivity, more of confidence into your lives. That is the key. இப்போ எனக்கு சந்தோஷமா இருக்கிறதுக்கு எதுவுமே இல்ல. How can I be happy when things are all haywire and nothing is going fine? How can I be happy அப்படினா? Think of the happy moments. Why do you want to think of something bad which has happened or something which is going to happen? ஏதாவது ஒரு படத்துக்கு போறீங்க, படம் பிடிக்கலன்னா திருப்பி அந்த படத்தை பார்க்க மாட்டீங்க இல்லையா? Yeah, you go and watch a movie. If you don't like that movie, how many times you go back and watch the same bad movie again? I don't do that. Okay, I can watch a happy movie many times. So relive your happy memories. Don't relive